today is Ryan Lee. He's the CEO of Coastal Carolina. Recently, they were taken up, Coastal Carolina, who was with Tenet, has been taken over by Novant, correct? Novant. Well, anyway, before Novant, he was with Tenet, and he's been in the hospital or medical field for the last, how many years? 12 years. He has a deadline. He came as a favor to me, and he has a deadline. So, with further ado, Ryan Lee.
Hey everyone, can you hear me?
Yes.
Microphone okay? All right, great. So I'm Ryan Lee. I'm the CEO of Coastal. I'm happy to be here with you all. A couple of things. One, I joined Novant Healthcare in February as the sitting CEO of Coastal Carolina under Tenet. And one of my first questions was, what does Novant mean? It's a made-up word. As they were merging about 15 years ago between Presbyterian Hospital in Charlotte and the hospital in Winston-Salem, they just kind of made it up. So I don't really know how to pronounce it, but that's how I've been told. I do have a little bit of a tight deadline, so I apologize if I run out right around 4:30. My wife and I'm under strict obligations to be traveling this weekend, and she thought we were leaving at 2, so she got a little bit of surprise. But, said, well, I got one last meeting, and I'll be right there. But I'm really happy to be here with you. I'm going to cover a couple of topics. I'm also happy to answer a handful of questions. In healthcare, a lot of questions sometimes are personal. If we need to do that and have one-offs, I'm happy to do that. We may or may not have time today given my travel schedule, but I would be happy to follow up with you. So Hilton Head Regional Healthcare, as we know Hilton Head Regional Healthcare, it is Hilton Head Hospital on the island, Coastal Carolina Hospital in Hardeeville, Tidewatch Freestanding Emergency Center right here on 170, and then we have our physician practices, and we have affiliated physicians all throughout from Hilton Head to Hardeeville from that. We are proud to now be part of Novant Healthcare. That transition happened in February, and so I am 90 days in as a Novant employee, so I'm happy to be here with you all. As you all know, and as many of you have joined this area from elsewhere, we're not a typical small community. You know, I grew up in Aiken, South Carolina. It's about 2 hours from here. It's about 60,000 people, so a little bit smaller. But this is where my family and I have called home for the last 2 years, and before that, 4 years. So I was here in Bluffton at Coastal for about 4 years, left. I've been in several other markets, running hospitals, and then came back to Bluffton 2 years ago because this is such a wonderful place, as you all know. One of the questions I get a lot is, why are you in healthcare? So I was 12 years old and my mom had breast cancer, and she is a survivor. She will celebrate her birthday coming up. I won't tell you her age; she would kill me. But she is a 35-year survivor of breast cancer, and so while I wanted to make sure that I had an impact in the health of the community in which I lived, and in college I was far better at finance than I was biology. So here's our systems, as I talked about, all of our pretty buildings that we have. Who here has been to one of these buildings? All right. What I say in healthcare is I'm sorry, and our goal is to get you feeling better and never see you again, okay? But we're really proud of the physical assets we have in town, and our goal is to continue to expand that to meet the needs of our changing community. We did that most recently with Tidewatch. Tidewatch is a full standing, it's a freestanding, but it's a full ER. same ER physicians that work at Coastal or Hilton Head take shifts and work at Tidewatch. The same nursing staff rotate amongst all of our ERs. It has the full capabilities of imaging. So it has a CT, it has X-ray. The lab is there, it's the same on a smaller scale that we do in our hospitals. We take everything from bumps and bruises to gunshot victims. So it's a full-fledged ER. We're really proud of that. I've noticed a few of you showing up by golf cart, so I know it's convenient for Sun City. But we also do far more than just emergency care. And so the next several slides, I want to give you a brief background of the care that we do provide. Now, between Hilton Head and Coastal, we do a little bit of a divide and conquer so that our facilities can be experts at what they do. And so at times you'll see that we transfer patients amongst our facilities based on the specialties. For cardiac care or for your heart, that's Hilton Head Hospital, and it's one of the best cardiac hospitals in the state. We have an open heart program with Dr. Perry. He's Cleveland Clinic trained. That's a big deal because when my mom, who I spoke about before, had open heart surgery, she had it with a Cleveland Clinic doc. That's how strongly I believe about the skill set of Dr. Perry and his training. But we also do some very high technology. A Watchman is minimally invasive for AFib, and we also do Impellas. And so Impellas is an alternate route for caths. We will have cardiologists come and give talks, and they can give you all the intricacies of that. What I know is that it's far better to get the most advanced care that you can, and these two technologies a lot better. I also know that they're not cheap for me. And so that certainly helps that we're providing that high quality care. For women, Coastal Carolina Hospital is a women's hospital. We take that very seriously, and that we have a unit dedicated to women. That's not just for delivering babies, although we do a lot of that. Last year we delivered almost 800 new babies. I myself have a Coastal Carolina baby, and so my 9-year-old daughter thinks it's her OB unit because she was born there. But we also have a high specialty of GYN care, and we do that with a Da Vinci surgical robot. That's a minimally invasive way to do surgery, and our GYNs do surgery at Coastal every day of the week. Riverside Women's Care is that practice. It's 11 OB-GYNs. They do deliveries, but they also do full range of GYN care from that perspective. This slide also covers this, but Coastal Carolina Hospital received their first Da Vinci robot in 2015. We were the first hospital in the Low Country to have that technology, and that makes us one of the oldest programs. We've also done more robotic cases than any other hospital. We recently purchased our second robot in November, so now we have 2 robots that we use every day. Spine care. Spine care is going to be Hilton Head Hospital with Dr. Rubin and Dr. Boatwright. We use a robot that helps our surgeons have the guidance for their spine care. And that's really important as the imaging is a higher quality care as they're working through that. And Dr. Rubin and Boatwright have their credentials up on the screen. They are independent providers. They are not officially affiliated with our hospitals, but they choose to practice at our facility because of the care and the technology that we've invested in. There's a dedicated unit for spine care with nurses that only take care of spine patients. So it's very advanced. Yeah.
Not officially affiliated, but they choose to practice.
Yeah, so some physicians in our market are employed, meaning a entity affiliated with a hospital system will employ that physician, and some are small business owners. They completely run their own practice. They're completely independent, but they do privileges. So how hospitals work is that You have hospital privileges, which is managed by the medical staff. In some ways, you can think of it like an HOA, in that there's an HOA board, there's a physician governance board, and that is how the physicians look at who can join the medical staff based on their competencies, their qualifications, their training, all of that. And so these two physicians could practice anywhere they would like and do, but they choose Hilton Head Hospital because of the programs. Next up is urology. Urology makes up one of the largest percentage of business that Coastal Carolina Hospital does. There are four surgeons on staff at Coastal Carolina Hospital that do urology care. A fifth joins us in 2 weeks. And so again, another investment in the community on how do we grow with the needs. Urology is a big need here in this community. One of the big items that we do is that lithotripsy. So if you have a kidney stone and you need to have that kidney stone broken up, lithotripsy is a way that can be done. It is typically available a couple of days a week at most hospitals that I've been a part of. It's a mobile piece of equipment. The company that you pay for that services will have that piece of equipment at Hospital A on Monday, Hospital B on Tuesday, and it rotates. At Coastal, it's the only hospital in the area, and it's the only hospital I've ever been affiliated with. We have litho services available 24/7, meaning we own the equipment, we have a tech available on call 24/7. So if you need a kidney stone done, we can do it on a Saturday morning if needed. Again, our commitment and our investment in the care that we provide. I want to make sure that what we do is above, just a little bit higher than what is done elsewhere. The other component is on prostate care. The typical prostate biopsy is a little bit of a guessing game, right? They'll take samples of a prostate to understand if there's cancer needs. We use a piece of equipment that's a robot that maps with an MRI, and that allows our surgeons to know, without guessing and without as many probes, exactly where and if there's cancer on the prostate. That allows us to take a more scientific approach, if you would, take smaller samples or make cuts of the prostate that are not as wide. And again, highlighting that 2 Da Vinci robots here at Coastal Carolina Hospital. So for a hospital our size, that level of commitment is unheard of. A robot's about $1 million. And so it's a big investment, but that allows each of you and our surgeons to do surgery much faster, right? If you need surgery, you want to do it yesterday. And so that, again, opens up that availability. Hips and knees, we do a lot of orthopedic work amongst both hospitals. And so we do a lot at Hilton Head Hospital, but we also recently announced a partnership with Chatham Orthopedics. Chatham is an orthopedic group out of Savannah, Georgia, and they have 5 orthopedic surgeons that now practice at Coastal Carolina Hospital. And so we're really proud of that. Again, securing that level of care for our patients and the growth needed. It's really hard to go and find 5 orthopedic surgeons that are interested in moving here off the blue, and so having some docs that are semi-local out of Savannah come and practice part-time here certainly has added value from that perspective. We also have another robot. I hope you see a theme here. In all of our service lines, we are heavily invested in the technology, and a Corey robot allows our needs to be done with some assisted navigation. Again, very important for visibility as they're working on all this. And as we've talked about all these service lines, some of these slides highlighted, the high quality of investment that the hospital has made. Talking about all of these robots. Some have talked about the credentials of some of the surgeons, but here's some of the schooling that our providers have had, and it's the top notch. And it's probably the most impressive of any of the 7 or 8 hospitals I've worked in. Now, I'm not naive enough to think that the folks that went to Harvard and Duke and Johns Hopkins and Virginia are here at Coastal Carolina Hospital because of me. But I'm certainly the beneficiary of them wanting to live in Bluffton, and I'll take it. And so we've got really high quality docs that, just like you, are local. They live here. Their family lives here. Their kids are raised here. And so we're really proud to support them and to have their expertise right here in town. So very special from that perspective. And then quality. Again, I talked about the investments that we make into the hospital. It's not just for marketing slides, I promise, but the quality in which we do. And you can see here, primary stroke centers, acute stroke ready. Those are both. If you're having a stroke, time is of the essence. And our average door to needle time for a stroke is less than 45 minutes. The national average is 60. And so we take that very seriously and provide high quality care from a stroke perspective. And then you can see a list of these other recognitions. I'm really proud of the Zero Harm Awards. You can see them listed here. Several of those are infection-based, which means we've had 0 infections in either one of our hospitals. So the quality of care that we provide. And then recently we were named 5-star recipients from Health Grades on a number of service lines. And so we're really proud of an outside agency looking at our data and telling us that we're doing a good job. And so we're proud of that. But it's not just about the care that we provide inside our walls, right? It's about what we do throughout the entire community. Much like being here today, I'm happy to be here and share some updates. But we also partner with several very promising organizations throughout the community. Bluffton Self-Help, the American Heart Association, the Heritage Classic, Volunteers in Medicine. I was at their fundraiser last night. I think they raised $50,000 last night. And so the care that we're able to provide in the community goes beyond the 4 walls of all of our facilities as well. And then we're not typical, small hospitals. If you think Hilton Head Hospital is 93 beds, Coastal is 41. The last hospital I was in Virginia was 510. And so it's a little bit different, right? But what I'm proud of is that our 41-bed hospital, our 93-bed hospital, has more technology and has invested more in the care that we provide in that 510-bed hospital. So don't let that count determine the quality of care that we provide. And then we also take care of our people. Our employees are a big part of who we are. When you come to Coastal or you come to Hilton Head, my desire is that you see smiling faces. The work that we do each and every day is very, very hard, but our team are tight-knit. We have a low turnover, high tenure of our team members because they have seen how excellent Bluffton and Hilton Head are and want to stay here. We've also provided more than $100,000 in donations to those partners I mentioned. We also had $16 million in charity care. That is charges in which we could not collect because of lack of insurance or inability to pay from our patients. And then you can see some of the metrics here just from how busy these two hospitals are. Lastly, I want to close with, here's our local healthcare team. They are, again, they're from Virginia and Duke and Harvard and Brown and MUSC and all of these places that you should be really, really proud to see that you're receiving care from. But they're also just like you and I. They live here, they're a fabric of this community. You'll see them at restaurants and the grocery store. And we're really proud of that. And I am happy that every one of these doctors on this screen, I call a dear friend. and they are here to support you for whatever it may be that your healthcare needs are. And so I, along with them, are happy to be a part of Novant Healthcare and be a part of your community and take care of you. Thank you very much for your time. I'm happy, I've got a few minutes, so I'm happy to take a couple of questions. Yes, ma'am?
Hi, I'm also in the healthcare industry, but I won't be of any use to you because I do peds.
Okay.
But I do have a question. I think you said you were CEO under Tenet
Yes,
and now CEO over Novant.
that's correct.
What do you see as the advantages that Novant has come in? What are they offering that Tenet was not?
Sure, so I'll repeat the question just to make sure, because I'm on a mic, right? So I was CEO at Coastal Carolina Hospital under Tenet Healthcare, and I'm now the CEO under Novant Healthcare. And so what differences have I seen? What I would share is that, one, it's been since February 1st, so it's been 90 days. So there's a little bit of, we're still trying to figure it all out from that perspective. We haven't changed our commitment to the quality of care that we provide. But what I'm excited about is that we have a new opportunity to invest in our community in ways that we didn't in the past. Novant Healthcare is a not-for-profit entity. Tenet Healthcare is a for-profit company, for those that may not know. So we do have a switch in tax status, but also our ability to provide care in a different way. And I'm proud that what we'll do will stay here local in South Carolina.
Can you be more specific as to how a nonprofit, how there are, or what are the advantages of a nonprofit? I'm not sure everybody here would know that.
Yeah, so 90 days in, I'm still figuring out all the answers to that question. But I think I sit here today more optimistic than I've ever been about the care that we'll provide in our community.
Thank you.
Yeah. Yes, ma'am.
With Novant taking over, will there be any change in the patient portal? I'm wondering if it'll become any more user-friendly to interface with MyChart, which seems to be more universal. And that's one of the issues we have with when you're seeing a lot of specialists at, say, MUSC, trying to share information with Buford Memorial or Coastal doctors. Gets kind of difficult, and it just shouldn't be that difficult.
Yeah, so I don't know the exact answer to that. As we look at what our technology is going to be inside the hospital, that is something that we've already discussed. How can we make this better? But I don't know. I can't sit here today and say, yeah, it's changing, and it's changing on June 1st, or what that will look like. The goal will always be to be patient-centric in what we do and how we do it. So I certainly hope so.
Well, and I just would appreciate if you would share with them the difficulties that people in the community experience, because I imagine everybody in this room either has or knows someone that goes up to MUSC for care, for specialists. And it should be easy for the providers to see what another provider has advised or done and not leaving it on the patient to try to get that information through.
Yeah, absolutely.
So if you'd share that, I would just really appreciate it.
I will.
Thank
I will.
you.
Thank you. Yes, ma'am.
So are you experiencing a nursing shortage? That's a rhetorical question, but I want you to answer.
Yes, so nursing shortage, is there a nursing shortage? Globally, yes, absolutely. I think we, at Coastal have seen it better than others. I have good friends and colleagues all over the country that do what I do very similarly. And our vacancy rate, Coastal's vacancy rate and turnover rate are lower by tenfold of most of my peers. We have, you may have heard a lot about contract labor, using contract labor nurses. Coastal has two in total, and one of those is for maternity leave. And so Coastal has seen better staffing than what I would see. Hilton Head Hospital has sufficient staffing, but certainly could use some more. That commute over the bridge is provided, is challenging at times. But both of our hospitals have heavily invested in our workforce. We have temporary housing, workforce housing for our colleagues on Hilton Head Island. And so that is one of the initiatives we've taken to try to help in that perspective. But so globally, absolutely, if you know a nurse, thank a nurse. And if you know a nurse and they're looking to relocate, we're always hiring. Yes, sir.
What do you do about encourage reciprocity between hospitals in such a tight geographical area?
So
You can't get the question.
yeah, the question was, what are we doing about medical staff having privileges at both Hilton Head and Coastal? I would say 90% of the physicians do have privileges at both hospitals. There are a few that either only are at Coastal or only at Hilton Head, and sometimes that's based on geographics or historical trend. You know, Hilton Head Hospital was built in 1975, so some docs have only practiced at Hilton Head and may only practice at Hilton Head, and some certainly prefer to be here off island for care. But most cover it.
But the policy of the hospitals aren't to say pick one or the other.
No, we do not do that. No. Yes.
With the growing population in this area, is there any plans to expand your hospitals?
Yeah, so expansion of hospitals. So, we opened Tidewatch in 2019, and that was an expansion, right? That expanded the care that we could provide in emergency care. It's something we're always looking at. I look at it daily. Part of that is how many beds do we have from an inpatient standpoint? How many inpatient beds do we have? For Coastal, we just finished expanding. We opened a new OR actually Tuesday. We'll have our groundbreaking this coming Tuesday. But I didn't wait for the groundbreaking to put that OR into use. And so our surgeons are already using it. And so we'll continue to expand as we need from that perspective. Yes, ma'am.
So what specialties do you have on staff versus call-ins?
So let me ask the question again so that I understand. So what service lines do we have at the hospital? And then your question was versus what is call-in?
Well,
Can you clarify that?
So you have OBs who are on staff.
Yes.
The other doctors are on call.
Okay, so I think I understand what you're asking. So in our OB service line, we have a OBGYN in-house 24/7,
Right.
meaning they stay in the hospital.
Right.
NICU services, so we opened a level 2 nursery 2 years ago. The neonatologist stays in-house. Hospitalists, so that cares for our inpatients, they're in-house. Anesthesiology, so if there's an emergency surgery, or if there's an emergency from an OB perspective, emergency C-section, anesthesia's in-house. Most other specialties are on call and they have a 30-minute response time. And that's pretty typical across the hospitals. I'll give you the example of my 500-bed hospital was a trauma center. And for a trauma center, you have 2 physicians in-house. Everyone else is on call. So it's very similar.
So you said, what about this 30-minute?
Yeah, so it's a response time. So their physicians are compensated to be on call to respond if they're needed in the emergency department.
And when does that mean they show up?
So they show up based on the clinical need of the patient.
Okay.
So the ER doc works with the specialist to understand, I need you here right now, or we're gonna admit the patient and you can see them a little bit later, depending on the schedule. Yes.
Are your ER docs employees or are they subcontractors?
So emergency physicians are not direct employees of the hospital.
Is there a reason for that?
Just operationally. That's pretty common across most of the hospitals.
Yes, it's common across the country, it's also a problem across the country.
Is Novant just Coastal Carolina, or is it the other hospitals as well?
The question was, is Novant just Coastal or other hospitals? Yeah,
That is correct.
So Novant Health is 16 hospitals in North Carolina and 3 in South Carolina.
What are the 3 in South Carolina?
So Hilton Head Hospital, Coastal Carolina Hospital, and East Cooper Medical Center in Charleston.
Okay.
We promised, or I promised, Ryan that he could leave. Thank you very much, Ryan.
Thank you.
And what I'll do is I'll get a synopsis and we'll provide it back when he has more behind him, more experience behind him with the new company. Thank you very much, appreciate it.
Thank you, everyone.